Awesome. All right. Good morning. Thanks for joining us, Julia.
Thank you for having me, Rebecca. I'm really grateful to the Children's Airway First Foundation for offering to be an ally in all of this outreach and support for parents. So,
Oh, yeah. Thank you so much. And, we feel the same about you. That's why we wanted to have you on because you've got a very unique opportunity for parents. We want to make sure that they hear about it. And if it makes sense for them, that they have the chance to reach out and chat with you.
that's great. Thank you so much.
Yeah. So let's just go ahead and jump right into it then. So before we really, get into what you're doing now and how you got there, let's just take a step back and talk a little bit about your own airway journey and and it is Oris, right? Oris Wellness. Just make
Oris
sure I'm saying
Wellness.
it correct. Make
Yes,
sure
that's
I'm not
correct.
slaughtering that.
The
Yeah. And
muscle around the lips is the orbicularis oris. So that was part of the origin in naming it. Yes.
oh, very cool. I like that.
Yeah.
So, just a little bit about your journey and how Oris Wellness came to be.
Perfect. Thank you. Yes. So I guess I would say a dramatic shift took place in my dental career. I graduated dental school in Indiana and was practicing there in what would be viewed as a conventional practice for a few years. And
Mhm.
then I relocated to Chicago. Once in Chicago, I had the good fortune of interviewing in a dental office called Wrigleyville Dental.
Mhm.
They, on their banner on their window outside, it said holistic dentistry. And at the time, I kind of was like, I don't really know what that is, but I'm looking for a job. This is a great neighborhood. I'm going to go in and find out a little more. So I went in and I was able to connect with the owner, Bernice Teplitsky, who became one of my most influential mentors. And she took me under her wing and really taught me a lot about how to view dentistry differently than how I had viewed it in previous years. And so, one of the things that really happened was she was already well integrated in Chicago in kind of working collaboratively with other providers. So, I got to meet various professionals that she was familiar with. Dr. Kevin Boyd, who I know has been on this podcast
Mhm.
numerous times,
We love
among
Dr. Boyd. Oh yeah.
yes, yes, among those professionals. And other kinds of providers. I mean, she was very well connected into more integrative health centers that were offering just medical health or manual therapies and other kind of allied health solutions for patients of our practice. So when I kind of had the good fortune of becoming a part of this amazing network that's in Chicago, I initially kind of took it for granted. It was almost so easy to refer out to other
Mhm.
professionals that could help our patients. And it really wasn't until some time later when um, kind of two things happened. One is that I started to reflect on, there were certain parents that I would say, your child is exhibiting some symptoms of a problem here with how their face is growing or how their teeth are positioned. I would make a referral to one of those very well-esteemed providers that we trusted and relied on. And
Mhm.
6 months later, the parent would come back in and they hadn't gone yet.
Oh,
Um, and it was one of those things where I didn't really stop to ask myself,
yeah.
what was
Why?
the resistance? Yeah, what was the sticking
Yeah.
point? Had I not explained myself correctly? Was there maybe a trust issue with myself or the other provider? Were they just not ready? Were there financial limitations or other resources? So it was really one of those things that I didn't dive into. It took me a while to realize that that was kind of a pattern. And then
Mm.
the other thing that happened for me is that my niece, my family lives in Florida,
Okay.
and my niece was starting to exhibit some symptoms. She had crowded teeth. She was 4 years old, thumb sucking habit, some hyperactivity, some food allergies, kind of just some things that made me say, hey, I talked to my brother and my sister-in-law. I think we should have her looked at. And all of a sudden, I was faced with the fact that I didn't have that easy referral community available for
Mhm.
her. And I knew exactly what I was looking for. I was a dentist. I knew what my brother and sister-in-law were open to trying in terms of, um, there's always different directions that treatment can go. They were open to exploring an expander. And so I knew exactly what I was looking for, but it was really hard for me initially finding a provider for a 4-year-old when I
Mm,
didn't necessarily have these systems in place and strategies in place that I now offer for others. So
right.
that was kind of a wake-up call for me, was that here I am, a dentist that's knowledgeable in these backgrounds, on these topics, and it was quite a challenge. So for me, I was just thinking, how hard is this for the parent who doesn't necessarily have all the
I was about
connections
to say
that I have?
you were in the position that many of our parent listeners are in. They don't know where to go.
Mhm.
Hmm.
Yeah. So that was really my wake up call, into it was a slow evolution. I knew that I'm very passionate about the education and the early prevention approach. I'm all for taking a vitamin if we can treat with the vitamin instead of waiting for needing the pill.
Right.
So it was something that I wanted to make my perspective available, and gradually over time, I created my own business to do so. I wasn't necessarily clear at first what kind of help was needed, and it was definitely a process to for me to figure out what role Auris Wellness would play in supporting parents. But I'm glad that at this point I can say I do offer one-on-one consulting for parents, and we'll talk more about that.
Yeah.
And yeah, happy to have found my own kind of niche.
And it's funny, that happens a lot, especially around this particular topic, because it's just, there's this such a massive void in
Mm-hmm.
providers and education and just overall parent support.
Right.
So it's just I think that's awesome what you've
Thank
done.
you.
Yeah, for
Thank
sure.
you.
And it is so funny that you were in Chicago because you've got Lurie Children's and Dr. Darius and Dr. Kev, and you're
An
in this
amazing network.
amazing
Dr. Gavlis,
ecosystem.
Dr. Jenny Hobson.
Yes.
I mean, it was lots
And
of
they're all
people
talking
that
and sharing. And of
for
course you think that's
sure.
just this magical world everywhere, but there's something very unique happening in Chicago.
I agree. And I didn't recognize it until I started to look outside and see what was going on elsewhere.
Yeah, yeah, it's wild. So, and that's part of, we're all on the same boat, thankfully, pushing in the same direction or rowing. No one's pushing the boat. That
Yeah.
wouldn't work well, right?
I think that there is good momentum generally taking place in
Yeah,
terms of a broader set of services being offered and a broader
mhm.
awareness and meeting the demand that's there to support parents and finding those treatment solutions and finding those providers.
Yeah, and it is amazing because it is a demand. It's funny because the estimate's not funny, but the estimate is 400 million children. And you think, oh, it's such a huge number, it's not real, blah, blah, blah. More and more parents are becoming aware of it and they're looking at their child going, oh, he or she snores. Oh, we
Hmm.
have late stage bedwetting. Oh, they just told me my child has ADHD. I don't want to give them the medication.
Right.
Wow, could this be airway? People are starting to wake up to this huge number. It's real and it's right
Hmm.
here in our backyard. Yeah,
Absolutely.
it's crazy. So one of the things that you mentioned, and we have spoken with another holistic dentist before, but for parents who might not have heard that episode,
Hmm.
what is the difference between holistic dentistry and traditional dentistry as we know it?
For sure. That's a great question. I think holistic dentistry is kind of a broader umbrella term that promotes treating the whole complex human that's in front of you, right? You don't have this limited frame of just looking at the mouth. You really go into it with kind of having taken a step back to recognize that this is a lot that we're not expected to know everything. We have to work collaboratively with other providers who can provide their own areas of expertise. And I think airway dentistry is kind of one offshoot of what holistic dentistry can be, where we're looking at sleep and we're looking at allergies and we're looking at school performance. There are other avenues that kind of fall into a holistic perspective, but I've really taken an interest in honing in on that airway dentistry portion of it.
Yeah, and just to be clear, y'all aren't DOs. I mean, you're
Hmm.
still dentists, but
Correct.
you have a different viewpoint. I mean, if I could put it, don't mind my own words, you can
Hmm.
correct me if you need to, but I have heard this over and over. Airway, or the mouth, is the start of everything, everything to do with your body, everything. Um,
Absolutely.
so you guys are the
Digestion.
front of the train, basically.
Yeah, a lot starts with the mouth and a lot becomes visibly apparent in the mouth. You can see inside the mouth before you can see in other parts of the body. So what you might pick up on a dental x-ray that could be causing problems elsewhere in the body, some of the first areas of visibility to the problems, I guess we'll say, can start in the mouth.
And that is such a paradigm shift, at least for, I can't be the only one. So I suspect it's a lot of our listeners because you don't think, oh, this is really critical. You think, okay, twice a year, I'm going to go get my cleaning, I get my new toothbrush and toothpaste, and off we go. You don't
For
realize
sure, for
how
sure.
impactful it is.
Mm-hmm. Mm-hmm. Yeah, I hope that, I think as dentists step up to the plate to present themselves as more than just the tooth mechanic, that we're able to make that differentiation.
And I like the way you put it, tooth mechanic. That's great. Because one of the things that I've heard Ben Moralia say over and over and over, we're not here for the teeth, right?
Mm-hmm.
You're here for the jaw. You're
Mm-hmm.
here to grow the face. It is that important. And, even dentists aren't studying airway in school.
Oh no, absolutely. It's
Yeah.
I'm happy to say, seeing organizations like the Airway Revolution and their
Mm-hmm.
intentions of creating that change from within the dental institutions. I think that again, we're seeing momentum moving in the right direction. And I'm optimistic. We'll say that. I'm optimistic that things are moving in a good direction.
I agree with that. Yeah, airway revolution. I mean, we love what Victor and those guys are doing over there. It really is great. And then you have groups like Airway Circle,
For
that
sure.
are is really focusing on myofunctional therapy,
Hmm.
airway health solutions.
Hmm.
You've got Lauren and Ben over there really trying to train all the other clinicians that are involved so that we're all on the same page and let's all move. And to me, it feels it feels like we're actually starting to move because you have groups like the ADA now
Hmm.
that
That are
have an
meeting
actual,
that challenge. Yeah.
yes,
Hmm.
yeah,
Hmm.
there's actually a symposium coming up in Chicago of all places,
Yeah.
which we'll put a link to for any of the clinicians that are listening that want to join us. It's the end of May, but it's starting to become a conversation that more clinicians are having, and that's, to me, that's phenomenal. That's, we've got to get there.
Absolutely. Absolutely. I was lucky enough to be at the beginning of my dental career when the advice of starting orthodontic screenings at age 7 came out. To that already on its own kind of
Yeah.
shook things up. Now, how much of that is acted upon and implemented is still remains to be seen. But the fact that was before I discovered airway health or a
Mm,
biologic dental perspective. I was like, oh, that's interesting. I
yeah.
didn't pay attention to the fact like, oh, interesting.
Yeah, something different.
Yeah.
Yeah, and it's funny. I know it takes time, but you've got groups, like all the ones we've mentioned,
Hmm.
in the AAPMD. I mean, there's a big chunk of us. We don't have time. I know
Yeah.
change takes time, but there's 400 million kids. We don't have time.
They need help now. And that's one of the things when I first started my dental career, I overlooked a lot of things. There were patients in my practice who, of course, the classic, clenching or grinding, and I didn't stop to investigate that to the level or depth that I should have. Sometimes things like a gag reflex that I didn't properly understand,
Mhm.
whether for me, it was just making the dental appointment trickier. Like, oh, that 1 hour that they're in the dental chair, it's going to be harder because they have a strong gag
Right.
reflex. But
Yep.
stopping to kind of look at how that was affecting everything that led up to the child or adult in either case, arriving to the dental chair needing treatment, what was
Hmm.
going on that caused that gag reflex or that hypersensitivity, And did that contribute to the problems we were facing? And then moving forward, how is that going to continue to affect them as they carried on into life
Right.
outside of that dental appointment on the other side?
Right,
So,
right. And every episode, I swear, I say this, you didn't know. You don't
of
know what you
course,
don't know, right? So
of course.
we have clinicians are carrying guilt and I wish I had known, just like these
Mhm.
parents. We're all looking around going, I wish we knew.
For sure, for sure.
Right. So we're all here now and we're moving from
Doing what we
here.
can do. Yeah,
Exactly, exactly. So to that point, let's just kind of segue into talking a little bit about the services that you offer on your website. So I want to
absolutely.
start with the big one that I saw that I was
Mhm.
piqued my interest. What is concierge? That's very hard for me to say. Consulting, and what benefits does that offer parents?
Yes. So the concierge consulting is just kind of a generalized, kind of one-on-one coaching consulting offer. So what I have found is that most parents who reach out to me, they're feeling stuck.
Mm-hmm.
Um, so it's more so been a situation where these parents, they've piecemealed their education together. Some of them come in, they know all of the dental vocabulary by now. They know about different treatment solutions and paths that exist. They've really done so much hard work,
Mm-hmm.
but something doesn't feel right to them, or they're feeling fear about making that decision about, is this the best treatment solution for my child? And in other cases, it's strictly, I don't know who geographically can help me. Can you help me with that? And so I will do offer kind of after understanding what kind of difficulties and challenges a parent is facing, I can offer advice. I'll do some research and share information about who I think looks qualified to be able to help them. Sometimes that is starting with an airway focused dentist, but other times that might be a myofunctional therapist or an occupational therapist. Just kind of depends on what the primary area of focus is for that parent seeking care.
Yeah.
And that connects back a little bit to what I was talking about before when parents hit that resistance. It's one thing to kind of plant that seed and say there's a problem here, but the parent has to find the right motivation in order to move through kind of the stages of change. Because when they're first introduced to the idea of there's a problem here, so
Mm-hmm.
often it comes from a perspective of, oh, you're the first dentist who have ever mentioned this. And sometimes that's really welcome. And parents are like, oh, I've been looking for solutions for so long. Thank you
Yeah.
for finally seeing me. But other times it can be kind of jarring, I guess, for lack of
Mm-hmm.
a better way to phrase that. And I think that kind of working through where parents get stuck, meeting them to understand what their specific child situation calls for, what their experience has been, and understanding that I don't like when there's a rule that someone says, oh, every child has to do myo first or expansion first. I don't think rules like that work very well because who is your child? What's their experience been? And beyond that, what's your family experience like right now? What kind of time, resources so often are money, but we have to look at
That's a
time
good
and
point.
compliance
Yeah.
and involvement. There's so much that goes into it. So for some parents, there's a clearly defined pathway, or there's only one provider in that area that they may feel like, oh, this is the best person, so I'll go to that person and it's fine. But for others that are feeling stuck, we have to kind of unpack, why are you feeling stuck?
Right.
Are you not finding something that aligns with how you feel your child should be treated, or what your capabilities are in this moment? And do you understand at least enough to make an informed decision if now's not the right time for treatment? Do you know what to look for to prepare yourself for how things might change over time?
Yeah. Yeah. And it is so many things that you touched on there. One thing in particular, and we call them airway mama bears.
Mm-hmm.
And again, not to exclude the dads, y'all are awesome, but it's
It's
normally the
true.
moms driving this train. So airway
Most
mama,
commonly.
right? Airway mama bears. Happy
Yes.
to make airway daddy bear shirts if we need to. Um, but the research that they do, so many of them, when they have come on our podcast just to share their stories, I am blown away with their
Mm-hmm.
knowledge. The books they've read, some of them have attended some of the conferences, and
Mm-hmm.
it's just, it's mind blowing to me. But you have
Absolutely.
to, but sometimes you don't have the time to
Mm-hmm.
do all that. Or like you mentioned, you're just so overwhelmed.
Mm-hmm.
Um, and it is scary, especially if you're that parent that's sitting there with a child that the school has just told you, hey, you need to go have your child tested for ADHD. Let's get him on some medication. You don't know what to do. It's
Right.
overwhelming. You don't want to put your kid on medication, and it's just a lot. It's a lot for parents to try to unpack. And the other thing that is interesting is, you pointed out that right now, because the shift, we're at the beginning of it.
Mm-hmm.
Airway centric dentists or airway dental providers,
Mm-hmm.
they're not everywhere. They're hard to find.
For sure.
And, even with really great search tools, which I'll put a link for,
Absolutely.
that we have on our site that's powered by Airway Health Solutions,
Mm-hmm.
even if you can find one, maybe you can't get to Chicago to
Mm-hmm.
Dr. Boyd
Mm-hmm.
or Alabama to Dr. Harrell. You can't get to, one that's close to you or the closest to you because they're so far away.
Absolutely.
Are you able to connect them, or do you have enough resources to connect them with people like Dr. Felix Liao, who will coach a dentist in the area? And maybe the
Mm-hmm.
child's going to get a MARPE, but they don't know what to do. This particular dentist. Do you have those kind of resources available?
So I do largely start with a lot of the main search tools and that you've referenced, Airway Health Solutions, AAPMD, some of the
Mm-hmm.
main Airway Circle, a lot of the main kind of groups that you talk about that most often parents can have access to if they
Mm-hmm.
follow along to a lot of the other
Yeah.
information that's out there. But sometimes it's for me, it's following a trail. So like I would say, and again, it kind of goes two ways. One is that journey might lead to a certain type of provider. Say a parent's more interested in something like an ALF or something,
Mm-hmm.
where can we, some parents come in knowing that there's certain philosophies that they want or things they want to avoid. Um, and so kind of working through customizing what direction we can take that. So sometimes I'm able to go through some of the main registries, but sometimes it's following a trail. So I just had a family that worked with me. They're relocating from the US to Germany. So it's not just within the
Oh,
US.
yeah.
She was like, my two older children have already gone through this treatment. My younger one's going to need it. I need help finding someone. So in that case, it's kind of following different threads and getting there to
Mm-hmm.
we were able to find two providers within 30 minutes of where she would be living that offered the exact type of solution she was
Nice.
looking for. So it's sometimes I'm able to navigate those specific paths. I do think it's a little more of a challenge when a dentist, if someone's looking for the dentist, they can't find the dentist, if it has to start with, there are a lot of great organizations that will say, have your dentist reach out to us, we'll get them trained, we'll provide a solution, which I think is really amazing and supportive of a lot of these organizations. It can
Mm-hmm.
be a great tool to get more dentists on board if maybe the dentist had never heard of it, but you've got that airway mama that's saying, I
Yep.
trust this person, I like this person, I don't want to go somewhere else. But then you have to consider the fact that, that provider is just going to be kind of starting their journey with that parent. And that's still a welcome situation. That's what I had to do in some ways with my niece. I had to find an orthodontist who typically, she was very well versed in a lot of these tools and different solutions, but she never really treated the sub-6 population. And I
Mm.
was there saying, will you try? That's definitely not the normal approach that I would take if I have a parent coming to me to ask for help. But in this situation, we were all
Sometimes you
willing
have to.
to, yeah, we were in the fortunate position that since I was helping at Dr. Boyd's office at that time, he offered to directly kind of supervise that care. And yeah, can't say
Yep.
no to an opportunity like that. So all's well that ends well. She got some great expansion. Things are good. But sometimes it's finding a way around the care that's available. So whether that's virtual solutions to get started, whether
Hmm.
that's looking at, I mean, I think I don't, I know I keep kind of mentioning other organizations, but Tooth Pillow is increasing access to care right
Yep.
now with doing direct to
Oh, yeah.
consumer.
I'll put a
Um,
link to that because we actually have partnered with Two Pillow as well. Yeah.
great, great.
As I'm
Yeah.
saying,
So I
it's so
think that
funny. We're
there's,
all on the same boat all of a sudden. There is not, just to be clear for anyone that's listening, because
hmm
in several podcasts, you'll hear us mentioning other foundations, other organizations. This isn't like this is our thing, this is all we're doing. One thing that I personally have found that is so unique, I guess two
hmm
things about this airway movement that's happening, to pull Avis's, it is an airway revolution, but
hmm
um, we really are all united because we all have these different niches
hmm
and these expertise, and we send the parents, or because we focus on parents, but some of the others
hmm
don't. So we're sending adults to each other, and
Right.
provider, we can't train you, but we can send you somewhere that can be trained, and
hmm
it really is one giant airway universe that we're all starting to push together. And I think that's why you're feeling this momentum, which
hmm
to me is so unique. And the other thing is, and Dr. Boyd is an amazing example, nobody stops. It is 24/7. These
hmm
providers, these advocates, it is a passion that,
hmm
pardon the pun, we just eat, breathe, sleep. It's always airway because, at least for us specifically, it's children.
hmm
It
Yeah.
is that critical.
For sure. And yeah, I had the good opportunity to connect with Christy at your organization not too long ago to
Oh,
have that same conversation because I'm always looking for, I realize that my services aren't the right thing for everyone. So I need to know, like you said, where to send other parents if they're looking for a perspective of a sleep coach, if they're looking for a
mm-hmm.
perspective of somebody other than myself. I know I can't possibly be the right person to help all of these parents.
Right.
But I think that there is something so wonderful about the nature of the nature of airway dentistry is to work collaboratively. And I think that carries through into all of these providers. And that's one of the things that I really encourage parents to do is sometimes if they're having maybe there's always skepticism of a dentist. I
Of
think
course.
anytime you go in, there's
Yeah.
some skepticism there. But I think specifically with airway dentistry, like you open this conversation with is asking those providers, how did you get here? What's your story? Because I think that provides a very interesting perspective on who they are and why
Mm-hmm.
they've chosen to offer the solutions they're offering. I think sometimes on the flip side of that, there's a situation where dentists have very good intentions. They have a tool that they know how to use. Your child has a problem that needs fixing. And so sometimes it comes from a really good place when parents can sometimes feel like they're being pressured into one solution or another. And part of the dentist perspective is to use your professional judgment to offer a solution and not overwhelm. You're trying to slim down the options and
Right.
not overwhelm
Right.
a parent into thinking whoa, this is too much too fast. I need to take a step back.
Mm-hmm.
So sometimes I think just kind of empowering parents to have those dialogues with the providers
Yeah.
and really either understanding where they're coming from, understanding why a certain tool is being recommended, if that's the treatment path that they feel is correct, just making sure that we're understanding, oh, this tool is being chosen for my child specifically because of this reason. And maybe there hasn't been the proper amount of time dedicated to having that conversation because dental offices can sometimes be bustling and
Sure.
you don't always get to have that in-depth dialogue that can be so needed. But encouraging parents to feel confident asking the right questions and understanding kind of where that dental provider is coming from. I think that can move things through in another stage and make taking action easier, whether that does feel like the right solution to the parent or not. Sometimes they can say, oh, you're telling me
Yeah,
this, but like, you have to listen to that mama bear instinct and
you
then
do.
kind of take that step back and use that to guide you into the next step. I don't like that so often parents feel stuck. I understand it. I understand where
Yeah.
you're coming from, but that's kind of my goal and my mission is to help understand and see your specific situation and see if I can guide you in another direction.
And it is always different, right? One size doesn't fit all. And one thing I particularly have noticed, and it's a beautiful thing.
Hmm.
If I can go all woo-woo on it for a moment,
Oh, of
it
course.
is absolutely beautiful to watch in podcast after podcast and meeting these luminaries and change makers and things in person at different events around the world.
Hmm.
They mean this, right? Their hearts are
Hmm.
so in this, and they're open. At no point, at no point have I ever heard someone like Kevin Boyce say, "Nope, I know it all." No,
Right.
they're still learning, they're still growing, they're still evolving, they're still sharing.
Hmm.
This collaboration between dentists and myofunctional therapists and occupational therapists and lactation consultants, it's amazing to watch the synergy and this
Hmm.
knowledge that they're sharing. The part that seems, I guess, strange to me is there's this beautiful dance going over here of knowledge and sharing, and how are we going to save all these kids, and we're all going to do this together, and let's just keep learning and sharing, and I'm going to send this patient to you, and oh, this person knows this, and there's still a group over here that seems to be a little hesitant to come on board.
Hmm.
And I mean, if I can put you on the spot for just a minute, obviously
Absolutely.
it's an opinion.
No, by all means, go for it.
And I get it because the dentist, everything starts with the mouth, so great, they are the head of the train, but there's a whole other part of the train that is the ENT, the pediatric specialist.
Hmm.
Why is that particular? We'll just continue with the train analogy.
Hmm.
Why are those particular carts so hard to connect and get on board with this train? Where is the resistance coming from?
Well, I think we mentioned before, it's the academic institutions in part. You know, there's medical school and there's dental school, and
Right, right. And they don't get Airway either. It's my understanding. For most of them, it's what, 5 hours at most, or is it four, something like that? Yeah, not
I
enough.
guess it's going to vary from institution to institution, but at
Sure.
the end of the day, that's a line that was drawn in the sand, and it said medicine is this, and then kind of vision is this, and dental is this. But again, when you go in with that holistic perspective, and my goodness, I've had my eyes open. You said you didn't want to go all woo, but I'm like, bring on the woo, because for me, there were things that starting this journey, I would have just been like, meh, I don't think that's real. And then you see things, and over time, you can't pretend it doesn't exist. You can't
Once you
pretend
see it,
that, yeah, once you see it, you can't go backwards. And I think that's the thing is, like I said, there were times at the beginning of my career where I had an adult patient come in asking me about his neti pot. And I was like, why is this guy asking me about his neti pot? Like, I'm working here, not so,
right.
and
That
it
is the base of this.
correct.
So,
Correct.
hey, it's the
And
same
it's just one of
complex.
those
Yeah,
things that until, and I don't know, for everyone, it's going to be a different journey to arriving. And perhaps it was just early in my career, and I was trying to prove that I knew what I was talking about at that point in time. I was trying to prove that I was the professional they could rely on just
sure.
coming out of dental school. So it was harder to say, I don't know. Um, and for everyone that's going to look different. That was just my personality and what I think I went through. But I, I, when I first arrived at that office in Chicago, Wrigleyville Dental, she just asked me, like, do you have an open mind? Because that's really,
That's
that's
what you
the
have
first
to have.
step.
Yeah,
Yeah, that's what you have to be able to move into this space. And I think that goes for both parents and providers, because the providers, as you
yeah.
mentioned, that train maybe is moving more slowly than we want it to in various professions. But it's because we think this is the box that I'm supposed to fit in, and this is where I'm
Mhm.
supposed to help people. And until you take a step back and say, but this, this body part is connected to that body part, and
Exactly.
we really, there's the invisible strings that we can't, there's some we can follow and some that we can't follow. And it's just a matter of really, I'm not suggesting that someone needs to try some modality or treatment that they're not interested in or believing or I think it's always a journey for each parent to find, again, the path that feels aligned for them. So if I
Sure.
just tell a parent, hey, cranial sacral therapy or some other sort of modality, this is going to make your child, this is going to make a frenectomy procedure easier on everybody. If your child can go do some sort of osteopathic manipulation or otherwise, that's going to prepare their nervous system, it's going to reduce tension in the body. And that is something that comes from an open mind. If you would have told me that years ago, I would have been like, I've never heard of these other providers. Why are they going to help
Mhm.
a dental procedure? So
Yeah, and for
it's
parents
just,
that aren't sure, I'll put a link to Dr. Stephen Hall's podcast. Um, I think it was one of the third or fourth ones that we did, cranial sacral. And I did the
mhm.
same thing. And granted, I came from, the land of woo woo, so that is how I grew up. But so I was like, oh, this is gonna be fun. And by the end of it, I didn't want it to stop because I had so many more questions because I was not expecting Dr. Hall to come in and go, listen, I can do this. And all of a sudden, this is an alignment, or, oh, you have TMJ. I'm going to do a little, and boom,
Hmm.
you've got some relief. Never occurred to me.
Of
But we're
course.
back to, the DOs are probably listening, going, well, yes, we know everything's connected.
Right.
But the rest of us are here going, wow, I had no idea.
Had no idea
So it's
before. And so whether that's the
right.
provider that's now going to refer out for those adjunctive allied
Mm-hmm.
services, or whether
Yeah.
that's the parent that's going to say, okay, now I think that this is going to be best practice to support my child. And one of the things I talk to providers about sometimes when I'm just kind of talking to them, there's so commonly the hesitation to, I think for people for professionals who are earlier in this journey of finding the collaborative care, there's such a hesitation because you say, well, parents already paying me for this service, and then I'm going to send them to spend money on this other procedure. And that's just kind of a insight into the psyche of some of the providers. Believe it or not, parents, I know sometimes parents are like, they just want my money.
Right.
Not these parents, because the parents who listen to this, you are motivated and looking for solutions. I
But
understand
still,
that.
right. But there's still some, we've had some single parents come on and say, what do I do? This
Hmm.
is so expensive. Or,
Hmm.
my insurance wouldn't pay for it because they said that this is elective, just some
Right.
insane response like that. So
Hmm.
that is a concern. There are people that think that. We had Dr. Dave McCarty came on and
Hmm.
he opened the podcast sharing a story about a patient that, I don't know why I'm here. I was referred to you. You're here just to get money. By
Right.
the end of the visit, he's going, oh, oh, wow. Okay. So my heart is, oh, I didn't know.
Hmm.
So
And
sometimes
I,
it is just
yeah.
back to let's just be back to that open mind, both parents and
Hmm.
providers. Parents, when you're coming in, just have an open mind.
Yeah. And again, that doesn't mean for me, there's no rules. So it's not like if you're doing X, you have to go get Y. Like
Mm-hmm.
it's not a
Every
set.
child's different.
Every child's different, every family's different. You
Mm-hmm.
again, the mom knows, or the dad, the mom typically knows the child better than anyone else. And for some parents, they don't even need to stop and hesitate. They find a provider, they can go, they say, oh, this is right, this is it, good, we're getting this taken care of, and they can
Mm-hmm.
confidently move forward. But other times there's that voice in the back of the head, the hesitation, resistance, whatever it is. I think it's just really helpful to unpack that and see maybe there are treatment avenues that you didn't think about before that I
Mm-hmm.
can help guide you towards now.
Yeah, yeah. And you may not be living in one of those amazing centers like Chicago or Houston or LA
Hmm.
or New York, maybe, or Seattle. Sorry, didn't mean to leave y'all out. Maybe because you could be in, one of the outliers, and it's
Hmm.
just it's an interesting dance. So along with the parents, one of the things that you do that I think is so great is you're kind of our own little mama bear because you're taking on awareness within the community itself, talking to educators
Mm-hmm.
and other, clinicians and allied providers. What is that like? How did these outreach programs come into be?
For me, it was really while I started learning about all of the topics of airway health and airway dentistry, it was most easy for me to make some parallels to what I had seen when I was in grade school, thinking about classmates of mine who, in
Mhm.
retrospect, I was like, oh,
Hey, mouth
that
breather.
person was acting
Hey.
that way because they
Yep.
probably weren't sleeping and they probably weren't
Hmm.
breathing well. And I don't know, I think that is a quirky, I have a kind of a lot of memories that I can shuffle back through easily. But for me, that kind of set the stage that schools are one of the most important places to be looking for children who are at risk of improper growth that's affecting their breathing, that it's the cascade of effects. And I've tried to make several efforts to connect with teachers because I do think that if teachers know what to look for, they can better understand. And maybe they're going to stop before they say your child needs to go on medication. They
Hmm.
might be able to stop and say, we should explore this or we should look into this further to see what's causing these problems or this behavior. Sometimes it's behavior, but sometimes it's different kinds of behavior. So just a child who's excessively drooling, or, it's not necessarily psychological behavior. There's the
Right.
other factors that come into place.
Lashing
And if we
out.
can,
They could be sleeping.
for
Oh,
sure,
yeah.
for sure. And so kind of recognizing, giving teachers the tools to recognize that these can be problems. I think it's still hard to then bridge that gap, giving the teacher these tools to let them know what's going on or who they can seek help from in their immediate environment.
Hmm.
So those are things that I'm still navigating, but I've been fortunate to connect with some speech language pathologists who work in school systems, some Montessori providers who are really
Oh,
interested
yeah.
in kind of thinking about things differently.
Hmm.
And so
As
some
is the
of this,
Montessori way.
exactly,
Right.
exactly. So some of it is just connecting with those parents. I've made intentions to connect directly with schools, and I've had a lot of doors closed. No response, no
Sure.
thanks, not interested, of course. But for me, it's really important to offer that as part of this momentum that's going to bring us
Yeah.
forward. Is if we can bring more teachers on board, I think teachers that can feel comfortable raising awareness to these problems can be a really important step.
I would agree with that. And I'll just, kind of be a Lorax for a moment here because I come from five generations of teachers. I'm the only
Mm.
one, we're all cruising through and then I kind of go, nope. And then it goes to my niece. So, they're all around me, right?
Mm-hmm.
Teachers, special ed, teachers, reading consultants, principals, professors. It's just in our blood, right?
Mm-hmm.
Um, and I will say, I've had a similar conversation with colleagues before, and why are we putting more on teachers? Well,
Of
as I hop on my Lorax stump, I'm going to tell you, teachers go into that world for a reason. They love children. It's not for
Mm-hmm.
the money, it's not for the prestige. They love children. All the
Mm-hmm.
bureaucratic stuff that comes with it, they loathe. But if you can empower a teacher with a really easy tool to look at a child that they love and go, hey, I see this. Hey,
Mm-hmm.
parent, you might want to consider blah, 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 because here's what I'm seeing. That teacher is going to go home with a heart full of love and relief because they did what they're there to do. They're there to grow young minds and to help children and to give them love. And
Thank you
that's
for
what
sharing
we're
that,
empowering
Rebecca.
teachers to do.
Yeah, I think,
Yeah.
I mean, that's my goal is to make sure that teachers can have that conversation, but it's really powerful to hear your perspective on that coming from
Oh,
the family of
thanks.
educators.
Yeah, thanks. Thanks. There's a few things that I get kind of about, and that's kind of one of them. So
Yes.
So another thing that you do that is really cool, and study clubs are all over, but
Hmm.
I would imagine your study club, because of what you're doing, is a little bit different than the traditional study club.
So I would say so my study club is one of the ways and branches of the AAPMD.
Okay,
And
who we
I
love.
am, yes, I'm rounding up professionals still here in Portugal. So my intention is this um, I moved to Portugal. I know that's part of
I know
probably
we skipped
my
that part. Sorry,
introduction there,
she
but
was in Chicago. She
I'm
and her family have
now in
moved.
Portugal.
Yeah.
But yeah, I think that that's one of the things that's really rewarding for me is taking what I've been presented with in terms of working collaboratively and again, seeing that that's a strong movement in the US and trying to bring that here to Portugal to start creating a little bit more collaboration here within Portugal. Portugal itself is a country that's the size of the state of Illinois. So working
Hmm.
collaboratively should be fairly easy when you think about it like that.
Yeah.
But it's not necessarily the way that the mindset has been because I'm not sure that they've had. I'm fortunate to have joined a really great integrative medicine organization here in Portugal and gotten to network with some providers through that as well. Um, but again, they're still building in that stage
Hmm.
of working collaboratively. So that's something that right now I'm still building that list of people who are open-minded and interested to learn. Because I tell them I kind of explain what the organization does and what the quarterly calls would be. We're hoping to launch some in the second half of this year to actually start hosting all of them. But when I just meet with providers and explain it, they're like, but why?
Right.
There's
Right.
that thought process that hasn't necessarily um, been presented to them before to just kind of
And that's
work collaboratively.
yeah, and it's interesting too, and not just the collaborative, but just the whole airway movement in general.
Hmm.
I've had, luxury is the right word, but I've had the opportunity to speak with um, both dentists and allied professionals in Scotland and the UK and Dubai and
Hmm.
Australia. And then a parent whose podcast will be coming out shortly, who is originally from Denmark and now she's in Houston. I'm kind of blown away that, oh, this is going to sound horrible, but the US is actually ahead as far as this movement. It's not what I thought it was going to be.
Hmm.
Um, because traditionally it's the other way around on a lot of these things. And, granted, you've got Brazil, who's ahead of us as far as infant newborn screenings and things like that, which,
Yes.
yay,
And a lot of that comes over to Portugal because because Portuguese
yep.
is a common language, there's a lot of really great
Oh, yeah.
influence of Brazilian providers who
Oh, yeah. Oh, yeah.
provide the professionals here are stellar. But yes, I agree in terms of
Yeah.
creating that
It's just,
collaborative community.
it's interesting to me that there's such
Hmm.
a disconnect's not the right word, but just a lag. Is
Hmm.
that because of the just the way the healthcare systems are set up, or is it just movement hasn't spread yet,
The
or maybe both?
great question. Yeah, I wish I had the answer to be able to provide the insight to the why on that. But that's definitely something I'm working on is gradually getting to know more providers here and being able to create that network of support. One thing I will say, kind of what you alluded to, is, and maybe just by virtue of having the connection with some of the Brazilian professionals, but when I talk to people here, there's a little less of that resistance in terms of thinking about the health that of course chewing and eating processed food versus eating foods with various textures that of course that's going to make a difference on how the child
Right.
grows and develops. It's a lot easier of a conversation to have here, so that's an interesting insight. And another thing that I've noticed here is that I guess in Europe in general, there are different treatment solutions that focus almost a little more on the neurological health of the child, which is an interesting departure from what I've
Brilliant.
seen. So I think there
Oh,
are
I love that.
pros and cons to kind of each area, and I'm just excited to be having the experience to get to understand kind of these nuances and hopefully be able to make my mark and bring people together and create more
Yeah.
positive change.
And I love that. And kind of to that, I know you have some more courses coming. They're not on your
Hmm.
website. Could you give us just a sneak preview of what those
Yeah.
are?
Yeah, so my one-on-one consulting I found has been more helpful of a tool for the parents who already have been going through this journey for a bit and they've
Hmm.
gotten to a point where they need that help or support to get them over the hump. But I do
Right.
have an online course that's coming up that is meant more for kind of the setting the foundation for parents. The parent is maybe new to understand these problems, or maybe they're kind of earlier in their journey to considering what can be done, what different treatment solutions are out there. And this online course is kind of more of a DIY approach to creating your own action plan. So there's
Mm.
kind of an educational component that will empower you to know what questions to ask yourself, what questions then you might want to carry into meeting with providers, but also just kind of setting the stage so that you feel more confidence as a parent, knowing that there are different treatment directions. And so you're not sitting there with a blank stare in front of the first provider that you talk to thinking,
Right.
I have to go home and think about this. You're a little
Right.
more
Right.
prepared going into
Hmm.
that. So it's condensed. It's not meant to take up too much time because I know that parents are busy. Finding a chunk of time
Right.
to do an online course is not easy. But most commonly, what's happening is you are an active parent. You're spending hours in the Facebook group looking for answers or whatever pathway you're on. And this is meant to kind of create a more consolidated program um, to to just give you more confidence in creating an action plan and knowing where to go.
That is awesome. Well, and I will put the link to your website in the show notes. And
Perfect.
if it's out by the time the podcast comes out, we'll swap it out and put
Yes,
that. But
I just
otherwise, they'll show
actually
up in our resources area.
great, great. That would be wonderful. Thank you.
Yeah, yeah, and for parents that are actually watching this and not listening, over your give me left shoulder. See how good I am. Um,
That was good.
um, some of the books that we recommend right out of the gate. I mean, one's easy to see because it's big, it's yellow. It's James Nestor's book. If you
Yes,
haven't read Breath, man, that's a great place to start. Then
absolutely.
then sleep. What is it? Breathe, sleep, thrive.
Basic
Shireen
dive.
Lin.
Yeah. I've
Brave
got
parents.
four books that I put on my website as kind of starting points because I think there are obviously numerous resources out there. And if the parent's
Yes.
interested in one topic versus another, there's certainly different directions and different books that
Hmm.
are out there. But those
But
are
those are
some of
some of
my
the great
main
places to start,
to
right? Get
start
your
to get the
footing, get your sea
overview. And
legs. Yeah.
yeah,
And then
absolutely.
come take your
Absolutely.
course and then they'll know what to do. I
Yes,
love that.
absolutely.
So at the end of every episode, I always hand it back to the guest because, whether you're a provider or a parent, you're the professional. You're the one everyone's here to listen to. So I'd like to give you the floor for final thoughts.
Yeah, I think just kind of my overall, I guess, mantra when it comes to this space is just making sure that parents know that no two paths are going to look exactly the same, and that make sure that you can find a treatment pathway for you that feels well aligned for your individual situation, your unique child, what your family's facing. And if for any reason you're having a hard time navigating that, I'm here to support you.
That's right. You hear that, Mama Bears? Follow the link. Thank
Thank
you
you
so
so
much.
much.
Thank you, Julia.
Really appreciated connecting with you.
Absolutely.
Take care.